Schizophrenia by Alexis Cologne. What is schizophrenia? Schizophrenia is a debilitating mental illness that affects a person's ability to speak, think, and behave normally. It's a withdrawal from reality, also known as psychosis. The person can't distinguish real life from a hallucination. The disorder can cause an individual to have inappropriate actions and feelings, withdraw from personal relationships, and slip into delusions and fantasies. On the right, I've pictured a graphic that shows a person with schizophrenia and the symptoms. There are two kinds of symptoms, positive and negative, which we'll learn more about in the presentation. Causes. So the exact cause is unknown, but it is researched to be a combination of genetics, environment, and brain chemistry. Problems with neurotransmitters such as dopamine and glutamate also contribute to schizophrenia. So because there's no specific cause, there are risk factors. The first risk factor is family history. The COMT gene is located on chromosome 22, has been linked to schizophrenia. Then there's the dopamine hypothesis, which says the hyperactivity of dopamine can lead to schizophrenia later in life. Taking mind-altering drugs during teenage years. These drugs include marijuana, Molly, acid, LSD, ketamine. All these drugs put the mind in a hallucinatory or delusional state, and if you take them, they damage your brain, which can lead to schizophrenia. A risk factor during pregnancy and birth complications. So this is malnutrition and exposure to toxins that could have impacted brain development. Phases of schizophrenia. The first stage is the prodromal stage, which means the deterioration begins. This is when the symptoms cannot really be seen, but it's all in the brain. Next is the active stage, which means the symptoms become noticeable. Then is the residual stage, which is known as the recovery stage. The DSM-5 doesn't like to diagnose the residual stage because there is no cure of schizophrenia. You just have to learn how to treat it, and you're going to live with it for the rest of your life. The symptoms. So there's positive symptoms, which is the presence of aberrant response. This is disorganized speech. So this is affective communication becomes hard. There's something known as a word salad. That means a person will take words that mean nothing and put them in a sentence, and they can't be understood. So there's also delusions, which is false beliefs that are not based in reality. So an example of this is a major disaster is about to occur, even though there's no warnings, there's no indications that this disaster will occur. So it's a delusion. Hallucination is hearing/seeing something that is not really there. This is the most common symptom of schizophrenics. Symptoms continue. Abnormal motor behavior. So the behaviors can present in childlike gestures or unwanted agitation. Completing daily tasks becomes extremely difficult. There are two main terms. Dyskinesia, which is involuntary movement, which means the person doesn't have control of their arms or legs, and sometimes flailing will occur. Then there's catatonia, which is the inability to move normally. Sometimes a person will be stuck in one position for so long, and that's a symptom of schizophrenia. Then there's negative symptoms. A negative symptom is an absence of behaviors that are normally present. So there's the blunted effect, which is difficulty expressing emotion in their facial expressions, gestures, and vocal expression. So they can be given like the best news ever, but they're just stuck in a state of numbness. There's social withdrawal. The schizophrenics are usually loners to themselves type of people. There's anhedonia, which is the inability to feel pleasure. The person can't feel happiness. Again, they're just in a state of numbness. And then alogia, which is poverty of speech, which means schizophrenics are usually quiet people. They don't have much to say a lot of the time. And then, as I said earlier, what they are saying doesn't make a lot of sense. So, the epidemiology of it all. So, the prevalence is 1% worldwide and 1 to 2% in the United States. And the sex ratio is males are more affected by 30 to 40% than their female counterparts. This is a little graph I've included. It's the typical gender differences in schizophrenia. So, age of onset. Men tend to have earlier age of onset of schizophrenia, being 18 to 25, while women is later, 20 to 35. Pre-morbid functioning is men have poor social functioning, more schizotypical traits, while women have good social functioning and fewer schizotypical traits. Typical symptoms for men are more negative symptoms, more withdrawn and passive, while women are more hallucinations and paranoia, more emotional and impulsive, and the course. So men have more chronic, poor response to treatment, while women are less chronic and better response to treatment. Prevention. So there's no real way to prevent you from developing schizophrenia, but there are some things to do to help not get it. So you can have a healthy and active lifestyle. This means eating right and being active so your brain and body are both in the best shape they can be in. This is managing stress in healthy ways like reading a book, having a hobby like sports, bike riding, chess, like any hobby that is going to manage stress in a positive way. The third way is maintaining healthy relationships. So schizophrenics are super antisocial. So if you can maintain your healthy relationships with your friends, your partners, your parents, your family, this is really good. And lastly is to avoid drugs and alcohol, because drugs and alcohol worsen the effects of schizophrenia. So the treatment. There's no cure, and schizophrenics require lifelong treatment. So there's psychosocial interventions, which are individual therapy. The person can go and get therapy for their schizophrenia and how to live with it. And there's social skills training. So as I said, schizophrenics are super antisocial, so they need to learn skills on how to socialize, because socialization is a very important part of being a human being. Medication is the biggest treatment method of schizophrenics. So antipsychotics control symptoms by affecting neurotransmitter dopamine, because as we said before, dopamine is linked to the development of schizophrenia. So the most common antipsychotics are haloperidol, fluohenzine, and chloroprozine. Resources. So the National Institute of Mental Health is a resource, and Schizophrenia and Related Disorder Alliance of America, and the number is 1-800-493-2094. So if you or anyone you know is struggling with schizophrenia, you can reach out to these two resources to help you deal with that. And these are my references. Thank you for listening.